Oh my God.
Mm.
You guys make me nervous. Every time I'm in here, I feel like I'm on TikTok.
You're
When I used to be
like,
on TikTok. Cyrus, Oceana,
what's your
Ternit.
like,
Hi, Daddy.
Oh, that's your son? How old is he? How old is he?
Zach
5?
is at home with Zaira. No, 7.
7. Oh my goodness.
Just
Oh, he's
turned-
at school.
Just turned 7.
Oh my goodness. I saw Cyrus' daughter.
Yeah.
Beautiful.
She
She grew, yeah, she grew. Yes. I remember when she came in here.
Just give them 5 minutes.
Okay.
Or just a few minutes for the rest to join.
I was doing this at night, so I hope I remember.
Smart.
Morning, Colonel. Is that you?
Yeah.
Morning, everyone. Give them some time.
Tyra, Oceana, Evangelist, Ashley,
Ashley,
Termit.
Cornell. This is Cornell.
Where's this Hispanic guy?
Banji is also with Benjo.
Hey, how are you?
Okay.
You good?
B-A-N-J or B-E-N?
As in boy, E.
B-E-N-J-O.
J-O.
How do you spell his last name?
Asis. A-S-I-S.
Yes.
Then we have Abel. And who's this? Oh, there's Benjo.
I don't know him. Is new?
Yeah.
Oh, okay.
It's only That's Eduardo.
Is Chrissy in Arizona?
I believe so. Yeah, I think so.
That's the music. We have an artist here. Singer.
TikTokers.
Mm-hmm. They need to send gift for TikTok.
Really?
Is that Miley Cyrus or Lady Gaga?
That's what's her name?
It's Jackie.
Jackie singing.
I'm not sure about
I guess.
Here?
Yeah, sure. Whenever.
We're just waiting for the others to join. Let's give them 2 more minutes. Then
Mhm.
we can start.
We like salad and go.
I do like
Me too. Oh my God.
That's what I always get though.
Mm-hmm.
No.
No, they say hamburgers? No.
No.
Oh, okay. Don't. Mm.
Ringtone is scandalous.
Uh-huh. Need to change it for reggaeton or something like that.
Will make you wanna dance.
Mm-hmm.
Yeah, it's okay. We can probably start because we have limited time for my Zoom access.
Uh-huh. Yeah, correct.
Okay, so we have Marina, our on-call nurse. She'll be the one to conduct this training for
Oh
us.
my goodness. Hi guys, my name is Marina. As Cyrus say, I'm the nurse here helping Chrissy and I started here as a caregiver long time ago, like 7 years ago. Yeah, so particularly this house is very special, and also Christy, and I work with Cyrus, some of you, Syra, Oceana, all of you guys. So we learn a lot. Yeah, so when I came to America, some of the topic that really scared me was a topic that Christy wanted me to talk today, was the 6 medication rights. And I know that all gain the 6 medication right, even as a nurse, they keep it refreshing to us, the 6 right, of the medication rights. And why do you think all the time they keep it refreshing all the time about the rights?
Because it's important.
Uh-huh. Oh, you're pregnant. Look at me. I'm pregnant. Yes, because it's important. It's not bad and good answer. Why you think is important?
Because it's the residents' right to have the right medicine.
Correct.
Yep.
Yeah, because what happens if we give the wrong medication, something happen, and we're going to be responsible. Yes. So it's important that we keep talking about the 6 right, but this time it's going to be a little bit different, because when I was a caregiver, I would like somebody to stop and tell me that what I'm going to, or what we're going to talk about that. So it's a classic one. I try to do it fancy, but we're going to start with the right medicine. How we can make mistake in the right medicine? How we have the medication. I know that you guys do have the medicine. It's easy for you, but in another facility, they need to start looking for the medication, the right medicine. How we can make mistake with the medication?
Well, sometimes when you just pour the medicine on the cup, sometimes it just fell and you don't even know which is which. So the other medicine, we're just gonna go to the other cup, or without noticing it is not the right one.
Correct. Because
Like, what did happen to me the other day? I just took the meds on the right box. So one of the resident tried to count it. And she said, "This is not mine." Well, I said, "Do you have a new medicine?" And she said, "No."
They know.
Yeah, they know.
They know.
So I said, "You have to take the picture." I just check it, but I know that was her because there's a medicine that belonged to her, which is she's the only one taking that for 2 pieces of biotin. So I know for sure that was her, and it's not my error because that's for her. So she took a picture and sent it to
Cyrus.
And he said that's not her medicine. So I said, okay. And good to know that the resident
Yes, some of the residents. Yeah, that's what when I came to America, I said, "Oh my goodness, they know their medicine." Even if you say, "Oh, they don't, they are not in here, they don't know," they know. And some of the medication, the names, are like similar. Like, a blood pressure medication, hydroxyzine can sound like hydroxyzine for a psychiatric medication. So some medication sound the same, but it's not for the same purpose. So we need to be very careful with that one. For you guys, we have, I don't know, the system just in case you want to know which one is. I don't know how you guys know. But also, in my facility, we have the card and we have the name and everything. And also in the MAR, they put it, what is the reason why they take it. So the right dose. What happens if we need a melatonin 5 milligrams and then you guys have just one? What you guys do? One we have in the In the jar, 5 milligram of melatonin, but you just need 1 milligram. 5, and then you need 1. It's kind of difficult. That's why some facilities have, 5. I will give it, you give it 5, so they have 5. 1 milligram count, 5. Even us as a nurse, they teach us, how to count, how to do medication problems. And people are like, how I get 5 milligram if I have 1 milligram. So just count 1, and so you have 5 milligrams. So it's easy, but some of them, or sometimes we don't reorder the medication, and they say that we don't do that, but I do that. I borrow from another patient and, and give it to them. So the right route, how we can make mistake in that one? A right route. Well, how many routes we can give in medication?
To the mouth,
The mouth. What else?
topical,
Topicals.
cutaneous.
Correct. Sublinguals. Some of the medications have to be sublingual. Why? What is the reason? When I was a caregiver, I said, why it's going to put in the mouth? It's going to be the same.
Well, if it's sublingual, the effect is very instant because it goes directly to your blood vessels through the veins under your tongue. So
Correct. Perfect. That's correct. So when I was a caregiver, I didn't know so many stuff. And I was like, is this mouth? What is the difference? Because they swallow, they put it in there. It's exactly how Cyrus. Then when I study and ask questions, okay, now I know. So another right patient, how we make mistake. This one is easy. In my facility, they like to put almost the same name or the last name in the same room. Or sometimes the patient look alike.
But sometimes their name.
Uh-huh.
Like Kathy and Kathleen.
Correct.
So you just have to make sure.
Uh-huh.
Or whenever you give it to them, just let them read.
Correct.
Because when I was working here a long time ago, they just mix it
Correct.
because they didn't read it. And I told the manager before, you just have to let them read, which they follow it from the...
So, and another mistake that I like to avoid is like when I have my cup, I put the room number or the name because I work in a behavioral too. By the time I pour the medication, I have like 10 patients complaining about the CNAs, and complaining about the food, complaining about everything. And when I have the cup, I say, what I was trying to do. And then that's why I write the room number and the name. So by the time I go to their room, I don't forget what I'm going to do.
And you don't have to give the medicine if the resident or the patient is not there. You don't have to leave it.
Leave it in there.
You just have to give them right in front of them, because that would be one reason that you wouldn't be.
That's important, because you say, oh, but it's in their room. Yeah, but we have patients that are confused and they like to take stuff that don't belong to them. Oh, this is a candy. Yes. And take the medication. Correct. So it's to them, and I wait for them until they swallow. And remember, we have a patient that we need to check the mouth because they hide it, So the right time, how far we can give it? Like it's at 3 p.m. the
You
medication.
can give them an hour.
An hour before, an hour later. And this one, I want to talk a little bit more about the right documentation. Do you know that the patient have the right to refuse?
Yes.
Yes.
That was their...
Yes. Like that's what, when I came to America, I said, how are they going to refuse the medicine? Is the blood pressure? Is the blood sugar? But that was taking me time to understand that that's part of the 7 rights. The right to refuse. And also every patient have the legal right to refuse the medication. Unless it's a court order. I have a patient, here we don't have that one right now. We have a patient that, he's not mentally here, even like that. The judge was calling him and tell him his right and the consequence if he don't take his medication. Like this is the only part that even if it is a life save, like a blood pressure, blood sugar, what else? A medication that is like a life, they need to take it for, it's a life threatening. If they don't take it, they have the rights to do it. We need to respect the decision, even if the patient is not here, is not, I have the right mind, thank you. What stuff that we don't need to do. And I'm going to tell something that happened to one of my friends that do that, we do not force to take the medication. We don't, we need to, he say like patient autonomy come first. So my question is, if we have a patient right now, I'm a patient and I said, I don't want to take my medication. What you can do as a caregiver when a patient refuses a medication? Panic attack. I know. Okay, I have high blood sugar, high blood pressure. What you do in this situation? I know that happens to us all the time. What do you do?
I'm Mariela. Hi.
Oh, Mariela.
Hi. I guess
I'm a patient. They say, I don't want it. I hate you.
well, many times it happened to me.
Uh-huh.
But what I do first is to talk or try to make them understand that they need that medication because of this, of that, no?
Mm-hmm.
But then if they don't want to, I can tell that maybe 2-3 times. So then if they don't want, I don't do anything else. So I just say, okay, that's okay. And that's it. And then I report that, no?
Perfect.
Yes.
Yeah. It's 4 main stuff that we can do as a caregiver. As a nurse, it's a little bit more because we need to educate them, the consequence, the risk, and all of this stuff. But you guys have it simple. First, don't force them to take the medication. I have one of my friends, my good friend, that right now she is in a legal trouble because here we go, the nurse want to give it the medication. We worry too much for them, but we need to understand that they still have the right. Even if we know that they are mentally not here, we know that the blood pressure is to the roof and he is ready, for emergency. The nurse want to give the medication to the patient. So she called the 2 CNAs, and they say, grab the patient. So in this grabbing stuff, they was just grabbing his arm and they leave bruises. And here we go, the family, they appear, they know it's a problem. They appear, they show, now they are suing the company. They are suing the caregiver. They are suing everybody because, they force. I know that they don't do it in the bad way, but, because they want them to take the medication, but now they are in a legal trouble, because we force them and we forget that this is their right. So this second one, don't argue with the patient. I have one of my patients that she was a nurse. That's the worst patient I have. The nurse, this is the worst. What you say? Will you? Oh, nobody is a nurse in here. No. Wait, I have a patient that is a patient. A nurse being a patient is the worst one because they think they know, and they know. I know they know. She don't want people to argue with her, and it's true. Some of the nurses like to argue. to my patient, and I say, I don't want to talk to nobody. I want to throw myself on the floor. And I say, don't argue with her. Just let her calm down. Yeah, I say, I wait for Marina. I say, oh my goodness, what's going to happen on the day that I'm not coming to work? I know I work every day, but so what I do is I say, I told her, we're going to talk. What happened? And then sometimes it's like her needs, see, her basic need, like water. She don't being changed. She don't, stuff that she really need is not met. So now I want her to take her medicine, but her basic needs are not met. So that's what I do with her. I calm her down. I talk to her. I bring a soda. I go and buy soda, talk to her. Now when she's calm and we're friends, we are besties, then I can say, hey, here is your medicine. The doctor wanted to take it. And then you need to, with this is like a art for us to know how to approach them. You just don't grab a Cyrus here and you here, because this is going to be a fighting. I had that patient, that when I start my shift, she already threw herself on the floor from a little thing that we can avoid. We don't do that. We prefer to argue with them and then know how to fight. And little stuff that we can do, waiting for them to calm down, talk to them, knowing a mandatory voice, because can you imagine me, 80 years old, and here we go, you, 20 years old kid telling me what to do, and I'm an old person, that's also, add to that. So we can ignore the refusal. What we do, so we can ignore the, okay, I don't want to take the patient don't want to take the medication. What you guys do? She mentioned that, man.
Well, you just have to give her a moment.
Give it a moment.
Then documented it.
Uh-huh.
And then go back to her.
Uh-huh.
And use your convincing power.
Yeah, uh-huh.
And if it doesn't work,
that
is the time. You just have to keep trying
Uh-huh.
until she comes down.
Yeah.
Then convince
Uh-huh. Another person can help
the
you.
Document.
Uh-huh.
Because that is the only way to get out of the hook.
Uh-huh, correct. Yeah. Yes. And also no ignore, and like she said, document that. And that's what we're going to learn, to document the refusal. So in case of a legal issue, we are covered. Like nobody teach me that when I was a caregiver. I say, and it's important to do. And also notify the doctor. That's what we need to notify. One of my patients, she always refused, so the doctor the management know that she's refusing. So they, as a manager, they come with a new idea what to do. And how we going to chart? Like that was my scary part when I was a caregiver. How are we going to chart that a patient refused the medication? How you should chart that? It's just two simple lines that we can write it down. How you will chart?
Patient refused, and then what I did to try and get them to take it.
Yeah. I would like to write, as a nurse, I write it like be a long one just to cover me. So I put like medication offered as ordered, resident refused the medication saying, putting, I don't want it, or everything that they say, I don't want it. So as a caregiver, we don't say we teach them because we are not nurses. You guys say we encourage to take the medication. So that sounds good. No, okay, she don't want it. Okay, bye. No. Medication re-offered without issue. MD notified. So that's cover you. That's told Chrissy. That's told Cyrus. Okay. The caregivers, they're starting to do like a movie in their brain. Okay. They give it the medication. The patient say that, the caregiver again reapproach, and then, medication, was, offered without success or with success. And also to add that the MD is notified. So we do extra. It's not like, okay, they don't do nothing. Even when we don't have medication, like in my facility, before we just put medication not available. Bye. That's it. But now it's a new management. Now I need to write more. Like medication is not available. I call the pharmacy to show in court that, okay, the nurse do something. Like, okay, I call the pharmacy. I'm going to hold it until I receive it, or do something, do the extra mile. So, if somebody have an experience that want to share about about this topic, about the medication right, and you guys know that it's not just 7 rights, it's a lot of rights that they add, like the right reason, because you can give it a medication for the wrong reason. That's act like a mistake, a medication error. So also, in the MAR, I also, when I go and do new units, I don't know, you guys see me like this. Some of them, they take a picture so far I can hardly see their eyes. So I always say to my boss, can we just put the face, like I have in here, like you can recognize me, because some of the elders, they look the same for me. And sometimes they have the same name. And Cyrus, you pay attention how you guys have the picture in the MAR?
Yeah.
Yeah. So people, like, if a new person come here and work, they can recognize, okay, this one is this one. Okay. Yeah. Okay. So that's a good part. It's the one that I struggle in my facility, but then when I was starting looking at, I can't see. They look the same. That you see the face, a white person with a dress. I don't want to see the dress. I want to see the face, the medication. And that's it, Cyrus, about, I want to talk, a little bit, something that I would like to do, to know when I was a caregiver, about the documentation, because I say, how I do that? How can I protect myself? I don't want the bosses to think like, okay, they just say, I don't want it, and they might just put the medication in the trash and don't document correctly. And also as a nurse, we need to put like this sign and symptom and everything. When you don't give it the medication, at least observe them, and they refuse, observe the reaction, because if you don't give it the insulin to the patient, they starting to show side effect of that. Like, okay, then the blood sugar is going to be up, or the blood pressure is going to be up. So we need to pay attention. Well, guys, you have Cyrus, you have her, to tell them, I guide us. And then if you, sometimes that's normal. Sometimes the patients don't like you, or that they don't like you. You can tell another caregiver, hey, can you try different approach? When I used to be a CNA, I have one of my patients, she figured out I was LDS, so she don't want to take medication from nobody. So here we go. I need to go there, hold her hands, and tell her everything okay, you are safe, and hold her hands, and then she take the medication from the nurse when I was with her. If I don't work that day, she don't take the medication, because she trusts in me. And we can't lose their trust. And also, when we put medication like in the sandwich or whatever, we need to make sure they eat it, because is another person hungry that will grab that bread, that peanut butter and jelly sandwich, and eat it. So we need to still keep eye on the medication and where we put it, like in the milkshake or whatever. And also something that helped me a lot. We have Ensure, but I'd never say the Ensure, because like that sounds like medicine. So I always say, do you want a milkshake? But this is Ensure. I just put the medication. This is a milkshake for them. So when I go to start my shift, I say, nurse, I want a milkshake. They say, okay. So I put the medication inside the milkshake. Sometimes it's good to change the names. You are not lying. It's a milkshake. so they can take their medication. So it's just everything, Cyrus. I know you guys doing a good job, and thank you for all the job that you guys do to help Christy and Cyrus to manage the houses.
Application.
Uh-huh.
Yeah, let me just say something.
Okay, Cyrus.
All right, thank you so much, Marina.
Okay.
Appreciate you. And so for our case, we have Vanji, Oceana, and I know Eduardo and Debbie is our POCs for, assigned to refill our medicines. And I know it's not a very easy task. It requires a lot of detail, very tedious, because sometimes one mistake that can even cost, a life or, something bad to our residents. So thank you so much for doing those for our residents. And we're just all human, so thanks everyone for helping each other. If you see some error, thank you for
Hello, sir. Abis,
thank you for always being on top, making sure that the right persons are notified and we address everything correctly. Because as far as I can remember, we haven't had any medication error for the past year now, or more than a year,
Wow.
which is good. So good job, everyone.
We're going to take blood pressure medicine. Remember to check the blood pressure before, no after.
Check.
First, before and after. Uh-huh.
We have a resident.
Uh-huh.
Every 30 minutes.
Uh-huh, Mm-hmm.
And it seems she doesn't feel nothing.
Uh-huh.
It's just good.
Mm-hmm.
So she always, her medicine is a PRN.
Mm-hmm.
It's allowing her to ask every 2
Oh,
hours.
yes. Mm-hmm.
So, is it on the right? I just only want to know if I'm on the right track, because she's always asking, let's say, if she asked the quantity,
Mm-hmm.
and she said, "Can I have that one?" Okay, I'm going to give you, and then after 30 minutes, because she forgot it.
Uh-huh.
And I said, "Okay, I'm going to give you later,"
Mm-hmm.
and she forgot.
Mm-hmm.
So Quantipin is just only one. Oh, the tramadol.
Mm-hmm.
It is allowed her to give every 2 hours.
Mm-hmm.
But the way she was asking, it's not because of the pain.
Mm-hmm.
It is
Just
because of the behavior.
correct.
So I said, "I'm gonna give you later,"
Uh-huh.
and she forgot. So is it okay? I mean, because you cannot see that she's in pain. It's in here.
But the pain they teach us in nursing that we can, like my pain is my pain. Right now, I'm in zero pain, but you can discuss what is my pain. It's like my feelings, like my feelings. You can feel for me. If I'm saying I'm sad or I'm in pain, you can say, "No, you are not in pain." That's
Yes.
Yeah, because it's what we see. Okay, sometimes we know that they are, but they still have, but yeah, but because it's not in their like if every 4 hours they need to wait every 4 hours or every 2 hours, yeah.
Since she forget,
Correct. But we can tell the patient, "No, you are not in pain."
I said, "You just have to wait. I will be right back to you." And she forgot.
Yes, correct.
So that's the only way I can stop her from asking.
Too much. Okay,
Yeah.
okay.
She's asking, "Can I have this? Can I have the anxiety pill, the pain pill, all the pills that she was sleeping?"
Yeah, we all like this. As I say, we can tell them that your level of pain. Sometimes they say 10, but it's not even 10. It's 1. But we can't say that.
Because you can tell. I mean, you
They
can
still
tell
have the
she's
rights. We live in the
Oh.
country that everything is right.
30 minutes is
Right.
their right.
Correct. You just say, you just take it.
But 30 minutes is not the right.
Mm-hmm, correct.
him to take the medicine.
Uh-huh.
So I said, I'll be right back to you.
Or you already took it. Some of the patients, remember, we have the same with the cigarette, they forget. So, what we do in my facility, during my shift, I make it sign because they always forget something or the medication. You don't give me the medication. Here we go, the patient with the wheelchair, ready to throw herself on the floor and throw stuff and, oh my God.
All the rest of
Knocking the door. Oh, it's
you're
crazy.
gonna learn a lot.
Yeah,
From the rest of you.
Oh, yeah. You have a master here. Yeah.
Got a master out.
I'm just gonna check the attendance. So if I don't say your name, tell me your name so that I can make sure you get entered in the thing. James, Jackie, Ashley, Cornell, Oceana, Vanjie, Benjo, Abel, Zaira, Eduardo, Arturo, Mariella, Eduardo, twice, Francesca, Debbie,
Eduardo.
Cyrus, Christy, Marjorie. Did I hear Lucy? Was Lucy on here?
Abby.
Oh, Abby.
Abel.
Oh, Abby.
I don't know. Is Abby on here? Oh, no.
That could be the A.
There was
The
an
other
A. I
A.
didn't know who that was.
Marjorie.
No, Abel was under.
Abel showed, showing his full name.
Maybe that was Abby. Okay, anybody else? I didn't say your name.
Looks like.
Tyra.
She's on here.
Oh, okay.
Got her.
Josiah came to us. That's good.
Mm.
And that's it, Cyrus. And remember, blood pressure medication before. My CNAs, before I start my shift, they take it like 2 hours ahead. So I start my shift at 6. Do you think I need to recheck or I just use that blood pressure?
Well, you know, here the blood pressure always, because Kathy,
Mhm.
you know Kathy.
I know her.
Was having a high blood pressure. And then one time, he took the blood pressure, which is too low. I said, if it's the case, you just have to repeat it again. Because that is her normal. Her normal.
3 minutes.
Correct.
And that, the one that you use for risk is not really that accurate to compare the one that you have to put in your.
Correct.
So if that would be the case, we usually do it twice.
Correct.
We usually do it twice.
When I need to give a medication and my CNAs took it like 2 hours before my shifts, I take it myself because I don't know, the blood pressure is something that go up and down, and I want the more accurate one that I can have. Yeah.
And Kathy, one of the residents here, take 3 times blood pressure.
I know. I remember that. Right, Sire?
And one last friendly reminder, just make sure whenever we give PRN, we want to make sure that it is clicked in EMR and then specify, let's say, a pain level or the anxiety level or what's the reason, and then check for effectivity after like a few minutes or an hour. Because oftentimes, if we will have some problem with the behavior or medical condition. And then normally, if they have PRN meds, the providers will ask, have you given this, that? What's the effect? Oftentimes, I would see that it's not being clicked at all. So I'm like stuck in something that I can't justify why we still need to keep or a certain medication or change or increase the dosage. So that will help us a lot.
And this is effective, not effective, right?
Yeah, right.
So wait for an hour.
Yeah, let's say it's you can check in 15 minutes if it's just a headache, right? And then if they felt better, just go back to EMR and then update the pain level and then complete the
We
medication.
follow up.
Yep. In
Yeah.
EMR.
Okay.
Yeah, because that's important because
Cyrus.
those they need to adjust them, like ineffective, then they need to adjust them.
Guys, I'm sorry, we have less than a minute.
Yes, I have a question. For example, in case of anxiety, you put the level 6 or 7.
Right.
It's from 0 to 10. The 10 is the worst, yes?
Right, correct.
Okay, and in comments you can add I don't know, high anxiety or something like that.
Yeah. Why do you think the resident is anxious? Like, is he being repetitive or having some changes in behavior?